We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together. Welcome to the podcast this morning. Today I have with me my friend Holden Brown. He is an absolute expert, anesthesiologist, just down-to-earth, good guy, and takes care of his patients, and absolute expert in pain management. And today we are talking about Medicine 3.0, and it's just the evolution of medicine and how it's changed and how we're doing it differently now than we've done it before. And he had a very interesting topic that he presented at a conference that I thought we need to get that on the podcast. And that's about, often we talk about lifespan, like increasing our quality of life. But today we're going to talk about the quality of your spine, what you can do to prevent issues now when you're younger, and the key components that you can do so that way you don't have issues as you get older. So we're talking about spine health. How can you prevent things before they become a problem? So welcome to the podcast.
Thank you. Excited to be here.
So excited to have this topic, man. Tell us a little bit about this medicine. Let's just talk about medicine 1.0, 2.0, 3.0. Where's that all come from?
Yeah. And I should be clear that this is not me. I'm stealing this straight from Peter Attia. I don't know if you're familiar with Peter Attia much or have heard of him, but he's a pretty famous physician, and he practices longevity medicine. He has a clinic and he has a podcast, and they do tons of research, and he wrote a book called Outlive that I read and really kind of reframed the way I think about medicine. So all credit to Dr. Attia here, and I'm ripping it and applying it to my practice of medicine. So medicine can be broken down into medicine 1.0, 2.0, and we're transitioning hopefully to medicine 3.0 is the goal. So 1.0 is medicine that's been practiced for thousands of years, right? This is shaman and medicine passed down through the ages through like oral history. Like grandma did it this way, mom did it this way, we do it this way. You mix these herbs, you do acupuncture in these regions, and your chi flows better and you get better, right? And so there's good things, there's things that don't make you better, there are some harmful things in medicine 1.0, but that's what we had forever. Within the last couple hundred years, because of the scientific method, we now have evidence-based medicine. And that's where we're able to conduct rigorous studies to see what can we do to treat disease on a more scientific basis. And if it's not working, if it does harm, then we can catch it because of the scientific method and get rid of that and just find the things that work. It's a slog, but because of medicine 2.0, lifespans have dramatically improved. We have vaccines, we have antibiotics, we have this huge leap in longevity. And the problem with it, though, is it's really focused on disease. Like, how do you treat disease once it happens? And we're pretty good at it, right? You have diabetes, we can inject you with insulin. You have heart failure. Even if your heart completely fails, we have these machines called LVADs that you can plug into your circulatory system, and it can pump your blood for you. And you're wearing your heart on the outside. That's crazy.
I remember the first time I was in my first clinical internship in the ICU, and there was this veteran who was at the VA.
Yeah.
And I unplugged his LVAD, and it was the first time I'd ever done this. And my clinical instructor's like, you got to make sure you do this right. So he showed me once, and then it was my turn. And I unplugged the LVAD, and I had no idea. After a certain period of time, it starts beeping really loud, and it's like, meh, meh, right? And it just like freaks you out. But as soon as I unplugged his, he screamed as loud as he could.
Oh my gosh.
And I had instantly like a heart attack. I'm like, oh my gosh, I almost killed you. But he was just making fun of me. He's like, gotcha.
This was at the VA?
Yeah.
Typical veteran. I love it.
But yeah, these life-saving medical advancements that whether it be medicine, antibiotics, vaccines, devices, like we have all these things that are, expanding life, but maybe qualities.
It's
I
not
don't
the
know.
focus.
Yeah.
Quality's not the focus. It's what can we do to extend life, and that's how we practice medicine. That's how we are compensated for practicing medicine. That's the goal. And like I said, and you said, we're good at it. Getting better all the time. The hope is that we can transfer from a disease treatment or a sick care system, a disease treatment system, which is what we practice in right now, to a preventative care system where we're not focused so much on length of life, but quality of life. How can we increase our health span more than our lifespan? And if you increase someone's health span, lifespan's going to follow suit, right? The logic follows that if someone lives healthier until they're 70 or 80, their lifespan's probably going to improve too. And there's this gap where, again, this is from Dr. Attia, but where it's your final decade, and where the way a lot of people spend their final decade is in this, you can't really move, you can't really do your hobbies, you can't be around the people you love to be with because your health is so bad. The medicine's keeping you alive. Your health's so bad. If we can shorten that window, even if our lifespan didn't extend, if we could shorten the window between our health span and our lifespan, we can live a much more fulfilling life for those years.
And what a great focus to just shift those gears and say, let's focus on the quality of life rather than the number of years of life. We want you to live X amount of years really good rather than just like live miserably the last 10 to 15 because all this medicine is keeping you alive. Tell me, I mean, you're one of the only doctors that I know that has a business degree, an MBA. Tell me how this works compensation-wise, because you mentioned we're compensated with Medicine 2.0, with the way that we treat people and pretty much prolonging life. How does this new prevention work in the business world and compensating? And maybe this is so fresh, it's like we don't know yet. But how have you seen it work so far?
Well, yeah, and I shouldn't I shouldn't throw the baby out with the bathwater. And I'm not a primary care physician, right? I'm a subspecialist, but every primary care physician wants their patient to have the longest, healthiest life possible, right? And I'm not trying to degrade what they're saying, but it is the current healthcare system is focused on meeting metrics that insurance companies want you to meet and things like that, and you're compensated accordingly. For true longevity clinics that are really focused on increasing that health span, a lot of them are cash pay. They're cash pay clinics where patients go and they can get labs done, tests done, imaging studies done that insurance isn't going to pay for, and a physician can bill. There's a number of like different models they could do. It can be almost like a concierge service where you pay this much per year, you have access to me throughout the year, or on a per visit basis. I'm not really sure because I don't practice in that model, but it is outside of the traditional health insurance landscape.
Yeah, and I've seen a lot of affordable concierge services like this where you pay $3,000 a year and you have unlimited access to your physician as needed, and you can order all the imaging, all the things based on what they prescribe within their scope. And it's a great model because insurance limits so much of what we do.
Oh man,
it's like a daily battle. Like I have this gal right now that has got adhesive capsulitis, and she's gone through 6 weeks of PT, got 70% better, still has night pain. Everything points to rotator cuff tear or labral issue. And we've done our due diligence in the therapy world, and I just want to order an MRI. I sent her for an MRI because yes, the standard is to get an X-ray first, but I know there was no trauma, right? So I skipped that step, and then it took 2 weeks to approve it. So the patient's out 2 weeks, and then they approved they told me I had to get an X-ray. So then I sent in the X-ray, got it 2 days later, and then it came back normal as suspected. no issues. And then I sent her for an MRI, and then it took another 2 weeks to approve. So we're like almost 6 weeks after when we stopped therapy before we actually have the MRI. And she's getting the MRI on Monday.
Yeah.
And I'm like, and these are the issues we face as practitioners, right? Because it's just one delay after another, and just big issues. And this wasn't a topic that we were going to get in today, but I mean, that's what the healthcare revolution is about. It's helping people navigate the system. And I think if you have the ability to do a cash pay option, you find a provider that you really love and you trust, I think that's a great service.
Yeah, I totally agree. Yeah, I run into this every day with spines, right? Like, let's get an MRI of the spine, but insurance is requiring an X-ray first. So we're going to radiate your pelvic organs with radiation that's not going to give me any more information and help us in our treatment. Not that X-rays aren't ever useful, but I don't need it for what I was thinking we needed to do. But we do it. We actually cause harm, right, with the radiation, and then we can get the MRI. But it delays care, and it's a big issue. One of the topics we are going to get into with like bone demineralization, fractures in the spine. I've had to wait months to treat those fractures before because of insurance holdups. It's like, what? In what world is this fracture going to get better on its own? Why are we delaying this care? And they need to do 6 weeks of conservative therapy. When have you gone to the ER and they say your arm's broken, you've fractured a number of bones, and they say you need to do conservative care till we can get this leg, till you can walk again?
Yeah,
it doesn't make any sense.
Yeah,
fix the bone. So.
And it's so hard because we spend so many years, decades, studying this craft, becoming the experts, but then there's someone on the other side of the door that says, no, you're wrong, you're going to have to go this route instead. And some of them I agree with, but the majority I'm just like, you're just delaying care for the patient. And in the pain management world, if I'm waiting 6 weeks, if I'm waiting 3 months, what does it do to pain?
Doesn't get better. It doesn't get better. Yeah, it can if you are doing your physical therapy, exercising, losing weight. Great. If we can do that and it gets better, great. If it's pain that's not going to get better with conservative care, pain gets worse the more you feel it.
The more delayed care we have, if someone can't even get into therapy for 6 weeks, 3 months, because they're kicking this can down the road, it's significantly harder for PT to work or conservative care to work because the way that it rewires the brain.
Central sensitization, right? And there's a central wind-up process where the longer you feel pain from somewhere in your body, the better you are at feeling that pain. It's neuroplasticity, and it's a good thing that we have it. For pain, it's terrible.
Yeah, absolutely. But let's dive into the kind of 4 Spinemen idea that you presented at the Summit conference. It's really, just kind of summarize it in my own words, it's 4 pillars that we can do to prevent spine issues in the future. You talked about, why don't we start with osteoporosis? Tell us what you know about osteoporosis and how we can, helpful tips of how we can manage it early on in our lives.
Perfect. Yeah. And I'm gonna back you up real quick just because Spineman is like, what does that mean?
Yeah.
We're playing off from the 4 horsemen, and Dr. Attia, for your longevity and your health span, the 4 horsemen are metabolic disease, acute coronary syndromes, or essentially cardiovascular disease, dementia and Alzheimer's, and what was the other one? Not ringing a bell right now.
And while you're thinking of it, these 4 horsemen are essentially the 4 pillars that primary care physicians focus on to improve lifespan.
Or should be, right?
Or should be.
And these are the 4 things that these diseases take people down. Yeah. They're the things that prevent us from living long, healthy lives.
So they're kind of keeping that in the back of their minds as they are working with their patients to say, okay, we got to check this, we got to check this, we got to check this. Because they're the biggest things that are issues for the most population of people.
Right. Cancer was the 4th horseman.
Yeah.
So I said, okay, I don't practice in primary care medicine. How can I apply this to my realm of medicine, my sphere of influence, which is pain and primarily the spine? So I said, force spine, man, that's kind of cute, and I can use it at this conference, and now I get to use it with
Yeah.
you. So what can I be working on?
So you came up with that term.
The Spineman, yeah. It's like the four horsemen of the apocalypse.
I finally put that all together.
Yeah, I should have.
I got to hear it 3 times and then I get it.
Yeah, I should have connected the dots a little more clear at my presentation. But so these 4 conditions, and it's cute to categorize things into 4 things and to make a play on words. So this isn't all encompassing, but these 4 conditions, I feel like if we could be on top of these and prevent these conditions, we would do a lot better for our prolonging our spinal health span. So you asked about bone demineralization. Yes, that's one of the 4 horsemen, and huge problem. Risk factors for. I guess let me back up a little bit. Demineralization means that your bones are losing the minerals that it needs to stay dense and strong. Okay, and some of that happens as we age naturally.
And we typically measure this with a scan called the DEXA scan, right?
Exactly, yeah. And insurance will pay for one every couple years, depending on insurance carriers and age and certain metrics that you meet. But yeah, a DEXA scan is a low grade or a low energy X-ray that measures the density of your bones. It can also give you really helpful things about your body fat percentage and your visceral fat percentage and things like that. So anyways, a DEXA scan would tell you about your bone density, and people can be in the good range, like a normal bone density range. You can be osteopenic, which is like you're not good anymore, but you don't have osteoporosis, which is the lowest level, which really increases your risk of fracture.
Yeah, and a lot of people know that as brittle bones, right? As you age, your bones are very fragile.
Exactly. So, and fragile bones are hard to recover from. Medicine 2.0, hats off to them. They're coming up with new medicines all the time to try to treat this, and it works. Good old-fashioned exercise and weight-bearing activities, you could preach to this more than I could, has been shown to increase or at least stop progress. But some studies show reverse loss of bone mineral density.
Yeah, I was looking at some data on this, and just after 40 years old, your bone density declines up to 1% per year. But just a simple impact exercise routine, whether it be jumping, stair training, increases your bone density by 6 to 10% just in a 6-month period. And it's not running, it's not sprinting, it's not like jumping off of high impact things. It's literally like jumping up about 6 inches and then walking up and down the stairs. But just to see a 6 to 10% increase in 6 months by doing a simple activity like that is pretty incredible.
Yeah.
I mean, I was really interested in this. I did my own case study, which is kind of the lowest level research, one of the lower levels, but still important. But I took a DEXA scan for myself. I was starting a CrossFit workout routine, just some heavy weight lifting. And I hadn't done that in years, really since high school. And I was interested, what was my bone density? And I've broken 34 bones. And people have always told me, like, oh, you got to drink more milk and all this stuff. I had one physician tell me once, he's like, because my mom asked him that question, does he need to drink more milk? And he's like, well, you hit the ground at 60 miles an hour and no milk is going to protect a bone. So we found that pretty entertaining. But I wanted to find out what my bone density was, and it was extremely low. I was like 50 percentile. And I did a 3-month program, and my bone density nearly doubled in 3 months.
What was your program?
What was the program?
Yeah.
It was, I went to CrossFit 4 days a week, 4 out of 7 days, and lifted heavy weights. So this is nothing we prescribed to patients early on. But essentially it's squats, and we're talking with a barbell, heavy squats up to 85% or more, depending on the day. You have rowing, you have snatching, you have cleans, you have front squats, back squats, jumping on boxes, even doing pull-ups, different Olympic movements and gymnastic movements like rope climbs. But it's a huge variety of movements. But it literally doubled my bone density.
That's awesome.
And what's more incredible, I had my wife Lexi do a DEXA scan. I'm just curious where she is, and she is obsessed about what she eats. She was literally in the 97th percentile and she lifts weights maybe 3 times a week, but not like crazy. But we're going to talk about nutrition a little bit here, but she is really obsessive about what she eats and what goes into her body. And her bone density is like the highest level. So, food obviously plays a very crucial role. Tell us about the nutrition piece of this. We talked about resistive training, and I want to dive into that a little bit more because I don't want people to get confused by, just go to lift the heavy weights, right? We don't want to get people hurt, but tell us about nutrition a little bit.
Yeah, and I think that's huge. And I've seen women in their 80s engage with a personal trainer or a physical therapist and really reverse course just through that. And there probably is a nutrition component to it as well. With nutrition, we're really trying to not do harm. I'm not aware, and there could be out there. There probably is. I'm not aware of any studies that say, take this much vitamin D, and your risk of fracture goes down this much. It's probably been done. I'm not aware of it. But things that increase your bone mineral density, right? Vitamin D, calcium, making sure those two things are up to par. Decreasing, and this is not just for the bone demineralization, but speaking of diet, having a low inflammation diet, because inflammation's hard on all of your body's tissues, is important.
Yeah, give us a few examples of what would cause like a high inflammatory diet.
The big thing, everybody's a little bit unique, but the things that are going to inflame pretty much anybody are processed foods. And I am a bad example, so do as I say, not as I do. But processed foods are generally high sugar foods, right? Things.
Yeah, we had a topic this week in Summit rounds in the morning. A nutritionist spoke, and she talked about ultra processed foods. Because the definition of processed foods is really anything that changes the normal framework of a food, right? But she was talking about, veggies, we change the makeup of the food because we freeze them, but that could be really good. But we're talking about like the ultra processed sugars, Cheetos, Doritos, these things that completely change the makeup, even bread. I went through this obsessive phase when Lexi was teaching me, my wife, about all these different nutrition. She's like, just go look at the bread aisle, and start looking on the back at the ingredients. She's like, what's in our bread that we make at home is sourdough. It's literally flour, water, honey, or some sort of sugar, right? And those are
salt, maybe,
and some salt, right? Oh, and some yeast.
Yeah.
So less, ingredients on one hand. But if you look at bread, even what we think is good whole grain bread, you got like at least 25 to 30 ingredients.
Stuff you can't pronounce or have no idea what it means.
What is this?
Yeah.
Then obviously they got to increase shelf life because real bread is only going to last you 3 or 4 days. Right? It just gets hard. It goes bad really fast. But they have to put preservatives in these things. But what does that do to our bone density? What does it do to our bodies over time? But I found that really interesting.
That's almost like the nutrition 2.0, right? Like we went from like world hunger and populations not being able to rise largely a lot because not just disease, but famine, hunger. We can't. And then we found ways to preserve food, right? To treat that. And now hopefully we're getting back to something closer to food 1.0, but sustainable for large populations.
That's interesting you say that because it had a purpose. Right?
Absolutely. Yeah. Like we shouldn't throw the baby out with the bathwater. Like the reason we are the way we are now and then have all the things we have is a lot because of we're able to keep and preserve food.
Yeah. And it's so crucial, but keeping these things in the context of what they are and saying, okay, we know that. It doesn't mean don't consume it. It has a purpose, convenience, right? It's good that you're eating food rather than not eating food. But how can you do more of or less of the ultra processed food and more of the wholesome foods?
Exactly.
But that's great thoughts there. And I do want to comment on the resisted training just a little bit because I don't want to give the wrong idea of, these old 65-year-old women just going to go hit the gym on their own. The biggest issue I see with the anyone over 50 years old is that they have lived in a certain life where they went to work, and it was manual labor jobs. The majority of them, most retired people, is manual labor. And then as they get older, they stop manually laboring, right? And they never went to the gym. They never exercised. And so to throw someone in the gym that has osteoporosis, they have that diagnosis, and they're like, well, just get resisted training. I had this one gal, she joined our boxing program. And I was running a boxing program in school. And at that point, I was not very educated. I was just a young undergrad. I'm like, yeah, just hit the bag as hard as you can.
I remember you doing this program. It was awesome.
Osteoporotic woman, and we had, her gloves on and some pads on, and she hit that bag as hard as she could, and she broke her hand.
Boxer's fracture?
Mm-hmm.
Yeah.
Yeah, and, that was a really good lesson for me at a really young age in my career, because I was supervising, I was kind of teaching, and I didn't really know what osteoporosis was, and it, my professor kind of gave me a little bit of a hard time and then taught me as well. But it's this building the bridge and getting them to, what do they know? Do they know how to exercise? Do they have the tools? Do they have money to get a personal trainer? Do they have the time to go to a PT, right? These are all things that you have to manage for the patient and say, man, what's going to be the best thing for them in the small window that you have?
Yeah.
I mean, your brains are like ultra processing information, and you're really trying to get down to the root of what these patients need in a short time frame. Tell us the things that go through your head and how you make the most informed decisions for the patient.
Honestly, I mean, that's a big question, and I try to get him into PT, if I'm being honest with you, because I'm like, you need some guidance, unless they have a background in exercise and weightlifting. But and it's not just for osteoporosis. What I'm telling people that come in with some of the other things we're going to talk about, like degenerative disc disease and herniations and things like that, is we need to get you moving and in the gym, and I want you lifting weights, but I care less about how much weight you're lifting and more about your form. And that's, I think, for the purpose of what we're talking about right now, it's less about the weight, it's more about the form, and it's more about being able to be consistent.
Yeah.
And you can do a lot of good with consistency.
Oh, I love that. Yeah, consistency is really the key.
Yep.
It's not the load, it's not the intensity, it's about how often you're doing it, how consistently you're working on it, and then slowly progressing it over time.
Yeah.
We're talking about heavy lifting. People interpret that so many ways, right? But just start working on it. So the few tips: work on your nutrition. If you need advice on nutrition, talk to a nutritionist. But being aware of your vitamin D levels, your protein levels, your calcium levels is really helpful. And then resisted training program. And
knowing if you're at risk for it, right? If you've had a fracture in the past, might be worth getting checked. Other risk factors: being female, being
just female.
Just being female, right? Unfortunately.
Do we know why? Is there that kind of unknown?
I'm sure it has a lot to do with especially postmenopausal women, right? Because you lose the hormone drive, and bones will take a hit, the mineralization. So being a postmenopausal woman, being older, being white, being slight of frame or lower, underweight. So that's why during the presentation that I did up there, I put a picture of my wife on the screen, because she's very low weight, she's very white, and she's young still, and she's still very female. So like, this is something that runs in her family. Though. She is feisty. She is feisty. So maybe that'll be her saving grace. But if you are checking some of these boxes, it's probably something to keep in mind. If you're younger, start learning to do some weightlifting. You don't have to go out and compete for Miss Olympia or Mr. Olympia, but start doing some weight training and learning to do it now so you can be consistent.
I love it. Okay, let's dive into a few other things. So we'll jump back to number 1, the muscular deconditioning.
Yeah.
Dive into that for us.
Yeah, this is probably the most important piece of the puzzle, because kind of all the other horsemen are related to it in the same way as Dr. Attia's things, like metabolic disease. Like if you have metabolic disease, you're more prone to heart disease. You're more prone to dementia. This muscular deconditioning, I think, is kind of at the core of spine care. And muscles are awesome. You can grow them, but you can also shrink them. And if you don't use them, you lose them. I looked at some studies that showed that a person that is on bed rest is going to lose between 1 and 3% of their muscle mass per day. Per day. So after 3 days, someone that's going through this rapidly could lose almost 10%.
Dude, I got a study for you. I did this in school. We put college students, we called it the bed rest study. We put college students in bed for 7 days. This just reminds me of the study. We measured their intramuscular fat and just overall muscle, just how big their muscles were in both their quads and hamstrings, and then we measured how much force output with a leg press that they could do. In 7 days, these young college students lost up to 50% of their strength in 7 days, and this is complete bed rest. So they could only stand up to like a bed toilet, and then they had to sit back down. They couldn't take any steps. But on average, it was around 30%, and some lost up to 50%.
Of their strength?
Of their strength. Yep, and they lost up to 3 pounds of muscle mass.
Okay, and that's what the studies that I've seen kind of are in line with the study you did, that where you lose 1 to 3% of your mass, which is enormous, of your muscle mass, and about 4% of your strength per day.
Yeah.
So that's bonkers. So think about someone, your neighbor. Imagine this older woman, to tie these two things together. She has a fall in her house because she, for whatever reason, tripped over the dog. See that all the time. She breaks her hip or has a compression fracture because she has low bone mineral density. Then she's put on bed rest, and she's put on bed rest for several weeks. She's never going to be the same again. I mean, without extreme intervention, it's going to be very hard to get her back to where she was.
I can't remember. I did a hip fracture study, and I can't remember the exact percentage, but if someone falls from a hip fracture and they're over 70 years old, it was something around 80% that ended up passing away within a year.
So what I deal a lot with, because I don't do hips, I do spines, so I see a lot of compression fractures. Someone falls and their vertebral column compresses. Not quite as high as 80%, but it's
pretty high.
Yeah, it's like you're about 40 to 50% higher risk of dying within the next 5 years. There's a procedure I do where we can intervene early, and I can put cement back in there and try to expand that bone. That lowers it by a decent margin, but it's still it's terrible.
Yeah, and essentially they can't move anymore. Like, they hurt really bad, and all these muscles atrophy. They get weaker over time, more fall risk, and they end up getting sick for something else.
Pneumonia, because you can't move anymore. You're laying in bed. You're not swallowing properly, so you're getting pneumonias. Your loss of quality of life, loss of some of the cardiovascular capacity that you had.
Yeah. I pulled this statistic this morning that greater than 80% of chronic low back pain cases, and this is an AMA journal in 2020, that had multifidi and transverse abdominis significant weakness. So there's an association between the transverse abdominis, which is essentially the corset muscle for the spine. So it wraps around your entire body, and then the multifidi is on the back where it stabilizes the spine as you move. But tell us your thoughts on that.
Yeah, I send more people to physical therapy for that than I do anything else all day. I'm sending people. I want you to go work with your physical therapist on strengthening your core, and then I write on the back of a piece of scratch paper, while you're doing your PT, I want you to do McGill's Big 3 on a very regular basis. Just look it up on YouTube. It's free. You can modify it. You can do it against a wall. There's lots of modifications you can do, but I want you to stabilize your core, because these other spinemen that we're talking about, we can prevent a lot of those if we have a strong corset, a strong core muscle group that's keeping your bones aligned and in place. And just having weak core muscles itself, even if you don't see significant degeneration in the spine, hurts.
Yeah. And just to be clear, we're not talking about the rectus abdominis, which is a six-pack muscle. We're talking about, everyone wants a six-pack.
I want it.
We love the way it looks. It looks real sexy, but ultimately a six-pack doesn't lead necessarily to core stability. I think that's really what we got to highlight here. The McGill Big Three I love, especially for the beginning stages. There's a lot of people that think that the McGill Big Three is the end-all, be-all, that you just do that the rest of your life and you're good. Ultimately, that's the start, and then we got to build upon it, because it's building stability, building up bone density, because the muscles are pulling on the bones and making them stronger. It's creating more stability for when you move. But then people start doing a deadlift motion. Everyone does a deadlift, but essentially you're picking up your bag from the ground, right? So teaching people how to do the McGill Big Three while picking up a child, right? How can you translate? And the McGill Big Three, McGill is a researcher. You know him.
Stuart McGill.
Stuart McGill, he's an absolute legend in back pain research. He came up with these 3 exercises. Essentially, it's a bird dog, a dead bug, and a modified dead bug, and a side plank. So just 3 simple exercises that add a lot of value, especially if you have back pain. But then building upon it is so good for longevity, and getting more intense exercise. It's a great way to build it, and then just get more and more and more as you can tolerate it.
Great starting point. Good thing to probably, if you could do it on a regular basis, I think I'd have a lot less patience.
Yeah,
be happy about.
I love this stat. 2 sessions of resistance training a week can restore paraspinal strength by 20 to 35% in 12 weeks.
2 sessions per week.
2 sessions of resistance training.
That's wild.
And it's not even intense resistive training. It's just pushing your muscles beyond. It's pretty much 50% of your 1 rep max. So I know that's hard to measure sometimes for some people, but it's a low load, but it's resistive training twice a week. But you can get up to 35% of your strength back within a 12-week program. So it's not, these are all prevention techniques we're talking about, right? Very simple, but people will go throughout their life, and just life happens, and routines get missed, but it's not a lot. It's just a little bit things that you have, these little things that you do to your health over time that really make a big difference.
I think that's a good principle to bring up, because sometimes we hear about these things and we think, I've got to go to the gym for 3 hours every day if I'm going to be able to lift heavy and strengthen my core. Ain't nobody got time for that. So you can probably get 80% of the benefit of doing a lot of these things in 20% of the time you think it's going to take. If you just put a little bit of effort into these things,
rule.
The 80-20 rule applies in so many places, right?
Yeah.
If you do a little bit of effort, you can, especially in the beginning, you can get a lot of the benefit. And then there's diminishing returns, right? Mm-hmm. And we don't need to be, like I said, we don't need to be Mr. Olympia. We just need to live healthy lives.
Yeah. And that's what it's all about. How do we increase our quality of life? It's about doing these simple things and recognizing what you need to do, so you don't get to 70 years old and you can't even play with your grandkids anymore. Like, that is the time of life where you should be thriving. You have the most wisdom. You have the most insight into life and what really matters most, but yet you can't move anymore, right? And we want people to move into their 90s. Like, Medicine 3.0 is going to change the game, because we're going to prevent the majority of issues way early on in life, and we're detecting it earlier. We're giving education to patients, empowering them to do what they need to do, and then they just consistently do it.
Yep.
It's really, really cool.
It's so sad. I have so many patients. I hear it almost every day. Like, we retired last year, and then my back started hurting, and then we can't do the things that we wanted to do. Now we can't travel. We can't go do the things with the grandkids we want to do. What a shame. Some of it's going to happen.
Unfortunate.
Some of it's unavoidable, right? Life happens, but some of it's avoidable.
I love it. Let's go to number 2. We covered number 1 and 4 of the 4 spine. What's number 2? Spondylosis.
Spondylosis. So spondylosis is a catch-all term, really. It's Greek origins, right? Spondylos means spine. Osis means disease. So it's disease of the spine. It often refers to just kind of degeneration that happens with age. So a lot of spondylosis manifests as arthritis in the spine and some degeneration of the discs. Or it can be your spine segments are no longer sitting properly on top of each other. You have some shifting in the spine that we see that can happen. So it's kind of a catch-all term just for the degeneration that happens.
What can we do to prevent degeneration?
Yeah. A lot of it is what we just talked about. It's maintaining a healthy muscle mass, being flexible in the right places, having rigidity in the right places, and knowing how to move our bodies.
Yeah, I would say the biggest thing that we focus on in PT more than anything else is getting people a balanced spine. And what I mean by balance is your upper back should be very mobile. It's naturally just a mobile portion of your spine. And most people that have spine problems are very stiff in their thoracic spine. And then your lumbar spine should be very stable because it doesn't have the ribs. So it needs stability to be able to lift things, right? But people lack stability through their lumbar spine, and they lack mobility through their thoracic spine. So it reverses the motion because their shoulder is the next joint to the thoracic spine. So their shoulder has to have more mobility because their back doesn't. And then they start to arch at their lumbar spine and hinge at certain points because their thoracic spine can't bend that way. And why doesn't it bend that way? Because they sit all the time and they're in the same position for prolonged periods of time. And it's 90% of their life. They're in that position and they never get motion into rotation or into extension. And then they end up, you talked about the use it or lose it, they end up losing the motion for good because they never worked on it throughout their life. Right?
Yeah.
Does that speak true to you?
Yeah, absolutely. Absolutely. It's you explained it way more eloquently than I can, and it's obvious your physical therapy background, your expertise is showing. But if you don't use it, you lose it. Things that you can do to help prevent some of that spondylosis from happening: maintain your muscle mass, maintain a healthy body weight. That's big. Don't smoke. Eat the
What
right.
does smoking do?
So smoking affects your microcirculation, and we'll see patients that smoke have a lot poorer disc health, right? And it's not getting the blood flow. They have such a limited blood flow to start with.
It's vasoconstricting or making the vessels smaller.
There's vasoconstriction and atherosclerosis in the vessels that you do have.
So essentially, it's becoming the blood getting to those areas is significantly less because it's narrowing all the vessels.
Exactly. And the discs don't get much blood flow even in the healthiest people. So you add an insult like smoking, and they really get hammered.
I love it. How much does we talk about the best posture is your next posture. How much does that in your world seem to influence spine health?
I think it's huge. Tech neck, sure, I've seen tons of that, right? Posture's big. People ask me, so should I be standing all the time? Should I be sitting all the time? It's like, we were meant to move, right? You should be sitting. You should be standing. You should be taking breaks to walk and stretch. Desk jobs are hard on the body. I have some stats here about referring to that. Where did they go here? So we have sedentary lifestyle increases your risk of low back pain by about 24%.
Yeah.
Prolonged sitting increases it by about 42%. Prolonged driving time, so thinking about our truck drivers, almost 200% increase. Or, 100% increase.
So if you're a truck driver,
yes,
you're sitting for a long, long period of time. Last week we did a podcast on shoulder pain, and if you're sitting for more than 4 hours a day, you're 2 times more likely to have shoulder pain. But this is all coming together, right? Our bodies are meant to move, right? It's not the issue that you have the tech neck for 10 minutes. It's that you have the tech neck, and we're talking tech neck is in like way forward head, right? We're looking at our phones or we're hunched over for a prolonged period of time. We're talking about long time, right? What percentage of your day are you in those positions? It's not that you're there for 2 minutes. There's nothing wrong with that. It's that you're there for 7 hours and for 20 years. You do the math.
Exactly. So if someone's like being really good, they're like, I'm going to the gym 30 minutes to an hour every day, but then they go from the gym to their desk and they sit with their tech neck for 8 hours straight. It doesn't matter how that gym benefit is erased.
Absolutely. I laugh about that because as Americans we think that, right? If you go to other places in the world, people are moving all day long. In America we've convenienced things so much that the grocery store's 5 minutes away, or we can just get groceries delivered to our house. We don't even have to move much anymore, right? But that convenience has now led to lack of movement and now more disease and problems and issues, right? Because we've made life so easy that essentially it's a double-edged sword.
Yeah. I lived in Japan for about 6 years, and you don't see obese Japanese people. It's very rare. And it's a highly developed. It's not that they're not developed. They're super developed. I lived in Tokyo. But they had to walk to the grocery store, and they would walk to the train station, and they just moved more.
Yeah, and we drive everywhere.
Yeah.
You rarely see people riding bikes, unless it's just for entertainment.
I love driving cars. I love America, but we need to move more.
We definitely need to move more. Okay, let's go into number 3, disc degeneration. Tell us what we can do. What do you see in the clinic as far as disc degeneration? What do people need to know about it, and what can we do to prevent it early on in life?
Yeah, disc degeneration's huge, and it's. I'm going to sound like a broken record because, like I said at the beginning, a lot of these things are very closely tied together, very related. So disc degeneration is probably the number one complaint that I see in my clinic. Someone herniates a disc. It's compressing one of their lumbar nerves.
Tell us what a herniation looks like.
Yeah, so if you have a disc, a round disc, and you have a weak spot in it, it can herniate, like a hernia that you get in your abdomen, right? You blow out part of the wall, and part of that disc sticks out, and it can compress a nerve, one of the lumbar nerves that runs all the way down your leg. Longest nerves in the body go from the lumbar spine, the lower back, all the way to your toes, right? It compresses one of those nerves, and then they have that nerve pain that's going down their leg. People call it sciatica often. That's one of the terms for it. It doesn't have to be the sciatic nerve though, but regardless, a herniated disc or a degenerated disc has led to a herniation. It leads to narrowing. The technical term for it is stenosis. If you see that on your MRI report, stenosis in the spine. And you have pinched nerves, and you're living in world hurt. I have patients that are like, I've given birth without medications, and I've had kidney stones, and this is the worst pain ever. And it looks awful.
Yeah. Hey, I've never had it personally. I've treated thousands of patients with it, but I shouldn't say thousands. Maybe close to 1,000 by now. I'm still young in my career, but it's so intense. The symptoms that they feel, it debilitates them, and it really sets people back a lot. And 80% of Americans, are based on research, are going to have back pain at some point in their life, right? It's actually one of the most costly things in healthcare that we actually do, right? And you do it every day, so you understand it. You understand how many people are coming through your doors with back pain. But we're going to give some really helpful tips, and we already have, on how can you prevent these, right?
Yep.
We talk about nutrition, we talk about exercise, we talk about regular movement and physical activity. Is there anything we'd add to the list here?
I don't know that I would add. I would just reemphasize your ergonomics are really, really huge.
Break that word down for us. What does that mean?
I don't know the etymology of the word ergonomics, but the way you're spending your time, right? If you are slouching and you've got your back, your lumbar spine flexed instead of extended. Wish I had a spine model here, but if this is one vertebrae, this is a vertebrae below it. Right between it, you have these discs, okay? If you're flexing your spine, you're putting a lot of pressure on the front side of this disc here. And if you're doing that too much, or heaven forbid you lift something while you're doing that disc, like a clown balloon, if you squeeze one side, it's going to want to bulge out. So you're putting all this pressure right here. Instead of having a nice, even distribution of pressure, you got the pressure right here. That disc is going to herniate.
Yeah, and it's going back to the ergonomics, right? Ergonomics is the postural position that you talked about. If we're consistently in in the physical therapy world, we call it posterior pelvic tilt. It's kind of rounded lumbar spine. We're sitting in a chair for 15 hours a day. It's like every time I sit in the chair, my back hurts. There's a reason why. Your spine, you're putting it in a very specific position for a prolonged period of time. It doesn't hurt for an hour. And same thing, if I was to hold my finger back like this, I could hold it here for probably 20 minutes before it got irritated. But if I held it here for 8 hours, it would start to hurt. We'd all appreciate that, right? Same thing as with our spine. It's not a fragile piece of glass that's just going to break with any wrong move. It's ultimately the things you do consistently over time that's leading to that straw that broke the camel's back.
Absolutely.
You know what I mean? And sometimes it's not even the way you move your spine. Sometimes it's you're so overwhelmed in life and you haven't slept well, you haven't eaten well, and your body's just so physically fatigued that your back actually presents with pain. Like that's where you ended up having the problem, because your body's just like, I'm done, throwing in the towel. But these are incredible tips. Like if we did these 4 things, if we knew these 4 topics, every American, imagine what we could do with decreasing cost and suffering with low back pain.
One of the biggest, most expensive things in the United States as far as healthcare is concerned is low back pain. It takes people out of work, so we lose productivity. We're paying them disability. It's a huge, and then we're paying for their healthcare, for their injections, from guys like me, for their spine surgeries. It's a huge, huge problem. Yep. And if we could leverage these 4 horsemen and try to put them at bay, and I think the key takeaways to are physical activity, maintaining a healthy body weight, good ergonomics. Take a picture of yourself at your desk and show it to someone, or take a look at it, or take it into your physical therapist and have them look at it and give you some advice on what to do with your monitor or your chair. If we could do those things, I think you would be leaps and bounds ahead of where you would be if you hadn't done it.
Yeah. So we talked today about muscular deconditioning as one of the pillars of the 4 Spinemen. Spondylosis, and spondylosis is disease of the spine. We talked about disc degeneration and bone demineralization, and you eloquently kind of summed it up there for us. Can you sum it up for us one more time? In those 4 areas, like what are the key things you could do for each one?
Sure. So for bone demineralization, lift weights and get a proper diet, making sure you're getting the right nutrition in your body to maintain and keep a hold of those bones, and recognize if you're at risk for it. Okay. For spondylosis, maintain a healthy body weight. It trashes the spine to be overweight, and maintain strong core muscles and pay attention to your ergonomics. For degenerative disc disease, same things. Healthy body weight, ergonomics, strong core. And for where else are we here?
Disc degeneration.
Disc degeneration. It's going to be the same. Ergonomics, strong core, maintaining a healthy body weight, and for all of these, don't smoke.
Yeah, I love it. Ultimately, it goes back to living a good lifestyle. These are all simple things that a lot of people know, but I think the biggest issue is we get so caught up in life in our young years that we lose the vision of what we're trying to create in the future. That, we're trying to create a future of, financial stability. We're trying to go to school. We're trying to just get all these, check all these boxes so that we can retire, be with our grandkids, and be happy. But then we forget to take care of ourselves along the journey. Forget to do these little simple things that make the most amount of difference with health, quality, and longevity. But if we consistently work on these things and just start small. You don't need to go to the gym 3 hours a week. We already mentioned that, right? Just start small, 10 minutes a day. Move a little bit more. Pay attention to your positioning at work a little bit more. Get an adjustable desk. Advocate for yourself. They're not expensive, Get some advice. Get people in your corner that can help you. But prevention, medicine 3.0, it's the new medicine.
Yeah, baby.
I'm so excited about it. The last thing I want to cover today is what can we do as providers to implement this consistently, to make sure this is just the new theme, the new medicine that we're practicing, and not necessarily throwing out medicine 1.0 or 2.0. There's so much quality we're bringing from those. But medicine 3.0 is getting back to prevention and utilizing medicine the best way that we possibly can. But what's your thoughts on how we can all work together in healthcare to make this thing happen and focus on prevention?
I think things like you're doing with this are huge, because we can talk till we're blue in the face about it to our colleagues, but if we can, patients really drive their own care, and if we can get education out to the to the patients directly, and they're asking their doctors, their physical therapists about it, I think that's huge. For the healthcare professionals, I think if we could know the risk factors for these diseases, job, genetics, gender, for some of these diseases, and we could educate our patients on that, because we still need truck drivers. We can't tell everyone to stop driving a truck. We wouldn't live, right? But truck drivers could live a lot healthier and happier life if we gave them a little bit of education about things they could do at truck stops to help prevent these diseases.
How cool would it be to go to a truck stop and see a bunch of truck drivers doing some mobility drills?
Be amazing.
Like, they're doing some stretches on the side of their truck, they got a foam roll out on the ground as they're pumping. Like, how cool would that be? Because it shows that they just really care about the quality of their life, right? A lot of people think that it's just trauma. It's trauma that creates pain later in life. Most of the time, it's just neglect. If you do these simple things early on in life consistently, you're going to have a great spine for the majority, Any other last tips?
I think we've covered it really well. We learn about this in physical therapy school. We learn about this in medical school. If I'm talking to, if you have questions about your spine or your specific risk factors, if you go in and talk to one of your providers about it, I'm sure they'd be more than happy to go over this with you, or at least point you in the right direction. So take control of, what I would tell people is take control of your health. You're your own best advocate. As providers, we have a million things going on in our minds that we have to do. We're thinking about you. Unfortunately, we might be thinking about the last patient and the next patient. We are thinking about what we have to do to get insurance to cover the darn visit. And so things can get lost. And if you need to and you're not going to be pushy. We're not going to think you're nosy. Advocate for yourself, though, and ask the questions that you need answered.
Yeah, that's a big focus that we talk about on this podcast, is advocating for yourself and being curious. Ask good questions. Come with a list of questions. Be respectful of your provider's time. And you can even ask, how much time do we have? I have a list of questions that I'd really like to gain understanding on. But those are great techniques. Like, we can be respectful of each other and get the information that we need. But coming with questions can be really helpful. And it can guide our conversation to help us know what you want to know.
Absolutely.
Because sometimes we're doing our best to fill in the gaps of what we think you should know. But when you come with, okay, I know these 3 things, I don't understand these 2 things. Can you help me understand those?
And if you can, sometimes I get patients that come to me and with this problem, and I've looked at their MRI. They come in, and I'm leading them down the path that probably 90% of patients want. Like, they're hurting a lot, they want an injection. But you got the 10% of patients that are coming in because they're just concerned and they want more information. And if I knew at the beginning of that visit that you just wanted more information, I could have given you so much information in that time, rather than telling you about this injection that you had no interest in. And I love those visits. I love educating patients, and I could do a lot more of it if I knew at the beginning of the visit that's what they wanted.
Yeah, I love it. And if you, we are going to give a 5 exercises mobility document. If you click the link, or if you just comment in the underneath the podcast, we'll send you our top 5 mobility exercises for your spine to create longevity. It'll be a useful tool for you throughout your life. It can be helpful for you for longevity as well. But thank you, Dr. Brown, for being on the podcast. Where can people reach you if they need an expert in spine health?
Yeah, I'd say call someone else. No, I'm just kidding. So my clinic is called Premier Pain and Spine. I'm part of Premier Family Medical. We're located in Linden, Utah. I don't have much of a social media presence. It's probably something I should work on, but I just haven't done it. We're so busy getting this clinic up and running, and unfortunately, business is good. There's a lot of pain out there.
Yeah.
But yeah, my clinic, we're very available. I'd be happy to talk to anyone if you called in.
Just such a good group of people down there. Every provider that I've interacted with at Premier Family is just top notch. That's where I went as a kid, and our clinics will be down in Utah County very soon. But just such a good group of just compassionate, active listening group of individuals that really care about their patients. And I love the emphasis and the culture that you've developed around this medicine 3.0, because so much of medicine, we just want to prescribe medicine, but let's focus on the things that we can control before the medicine. And I love that mindset and working together as a team collectively for the best outcome for the patient. So thank you for joining us on this podcast today. Appreciate you so much.
My pleasure.